During the pandemic, what I saw was everything that had been a disparity or marginalization became a barrier, and it only intensified during the pandemic. In our community, the pandemic didn't cause anything. All of these issues were already prevalent.
I think the pandemic exposed a lot of inequities around the social determinants of health that need to be addressed moving forward. Housing, work, jobs. The most vulnerable population were the ones that either lost their jobs quickly or were deemed essential workers and had to keep working and risk the health of their families in doing so.
When PHI was approached by several philanthropies across the state to work with them to develop Together Toward Health, we saw that this was a huge opportunity to address many of the inequities that existed in the COVID pandemic and well before COVID.
I think one of the most important aspects of the TTH approach has been centering its response to COVID through an equity lens and really ensuring that we're reaching some of the hardest and most underrepresented populations in the state of California, and doing so in a way that builds trust with community by working with community-based organizations through community leaders and connecting them to local resources.
TTH was incredibly flexible and responsive to the evolving needs of the pandemic, both at the state level and at the county levels. The state, particularly in places like sort of urban areas in the Bay Area and Los Angeles, and then in the Central Valley amongst farm workers, in the northern part of the state amongst rural communities, in the Inland Empire, amongst both rural, urban, and farm worker communities.
With the TTH funding, it really let us get on the ground, and we were in a crisis. So if you have to spend, a week doing paperwork, that's a week that we weren't able to get out to get people scheduled for vaccination and testing. 2 months will be the difference in whether people die in our community or live. So that flexibility was everything.
A big part of what made TTH special was the networking and convening role that it played for its grantees. Basically, creating a peer network for learning and sharing about best practices, about how are you doing this, or how are you tackling this issue, or how are you reaching this population?
I think the most significant outcome of these funding that was provided to the LGBTQ collaborative in Orange County was that for the very first time in history, it really brought together all the organizations that serve the LGBTQ community.
It'll be very important to continue partnership with organizations like the Public Health Institute and Philanthropic Dollars to make sure that we're really engaging community organizations and community members who can do the deepest impact work that we need in our communities.
He said we could either have a health equity moment where we highlight these inequities, we address immediate needs right now, but nothing long-term happens. Or we could have a health equity movement where we really make some systemic change that will have a long-term impact on the community that we serve and address those inequities.
I feel like it's infrastructure that we have now that's going to create greater resiliency for our communities. And I'm really looking forward to the shift, not just in terms of what we continue to do around COVID, but how we take this model to respond to other entrenched issues that we've had in our community.
Through Together Toward Health, we've seen what is possible when community-led organizations, local health departments, and philanthropic efforts come together. There are broad impacts we can have when we provide flexibility and support for leaders on the ground, and this work has laid the foundation for equitable, sustainable, community-led partnerships for today and beyond the pandemic.